mind, body, and spirit. This podcast is dedicated to individuals who are on a quest to uncover their truth, understanding their genetic and spiritual DNA, and learning how to harness this knowledge to achieve optimal health. But this isn't just another health podcast. The Natural Podcast is here to ignite a spark of hope within you, reminding you of your innate potential for greatness. You are pure love, capable of living life to its fullest expression. Are you ready to embark on a transformational journey to achieve optimal health? On today's episode, we have Dr. Andrew Timos. Dr. Andrew Timos is an experienced osteopath and strength and coaching coach based in Melbourne. With over 12 years in the health industry, he specializes in helping individuals from everyday people to elite athletes recover quickly and return to their sport through a combination of strength training, manual therapy, and holistic approach. Dr. Timos works closely with ultra marathon runners, martial artists, and hybrid athletes, he also teaches fitness certifications to inspiring personal trainers. In his personal life, he enjoys strength training, mixed martial arts, and playing the drums and guitar. Welcome to the Natural Podcast, Andrew.
How you going, mate? Thanks for having me on again. It's been a long time.
Yes, it has indeed. I love having you back on. I've seen you've taken on a new level of guitar skills. How's that going?
Yeah, I mean, that's one of the best things that happened to me during a very poor time in the world. During COVID, I'm just like, well, I want to learn a new skill. I always strive to learn new things. I'm always learning new things all the time. But this has been something that's been on my mind for literally the past probably 15 years. I mean, growing up, I played drums in heavy metal bands throughout high school. Like when I was 14 years old, I was in a heavy metal band with guys who were like 18, 19 years old. And then after that, like in terms of the music side of my life, I then started DJing, but guitar was always in the background, but just, it always looked really hard. See, when I was growing up in high school, I was one of these kids where I wanted to do the easy things. And because drums just came naturally to me, I just stuck with it. And like, I used to watch how teachers used to teach their students how to play guitar, and it was just very complicated. I'm just like, nah, not interested. But then obviously now with technology and everything, like there's a whole range of teachers on YouTube, and you could do online courses, and they teach a lot better than the teachers I was exposed to, and just made a lot more sense. And then it's just become a natural thing for me, and I love it. I literally can't imagine my life without this instrument. Literally.
Yeah, you just
Yeah.
the way you were playing it, I was like, wow, it's definitely got like years, if not like, decades of experience. You just took it on and just went with it.
Yeah, I think obviously being in that environment, I kind of like that obviously accelerated my process in terms of how I learn things. But yeah, no, I've had dudes come to my house into my studio, and we've done some stuff, and they're just like, and they've been playing for 20 years, and they
Yeah.
go, man, like how are you this good so quick? I'm like, I don't know, man. It's just what it is. You put the time into it, and it's, it is. It's the quality over quantity. You put quality time into something. It's with everything in life, and you don't need to spend hours and hours and hours on things. It's quality over quantity. Have you heard that saying before? It's not practice makes perfect. It's perfect practice makes perfect.
Yes, I love that. I
That's
love
exactly
that.
what it is.
I love that. And the repetition and the drive, yeah, and the love.
Drive,
I
yeah.
mean, you said, you did drums, you're DJing, so you kind of do have a passion for music, right?
Yeah, well, it's one of these things that again, it just comes naturally. Like I remember, I don't know about you, but when I was in primary school, we used to have this thing where like we used to have like 30 to 45 minutes of music, and then 30 to 45 minutes of PE. Right, it was back to back, and all my friends were like, "Oh, I don't want to do music. Music's crap, and this and that." I was like, "Yeah, music's crap," but I loved it. I actually loved it.
Yeah.
I mean, but I loved PE as well. And then I remember one time I missed music class, and I was like gutted. And everyone's like, "Oh, you missed music. Good for you." I'm like, "Yeah, good for me." But I was like gutted. You know what I mean? So I've
Yeah.
always had a passion for it. But yeah, I've got
And
too
who
many
knew?
passions, Mahela. That's a problem. Too many passions. Too many
I
passions.
love
It's
it.
a bad thing sometimes.
I love that, go back to your primary school. I love that those two things are what you do now. Yeah, the
I know, yeah,
sports
yeah.
and the music. It's
And
like you didn't
music,
want to miss either one of them.
literally,
You're like, I
literally.
love both of them.
Yeah,
I
literally.
love that. And since we've spoken last, now you're teaching, which
Yeah.
is amazing. How's that going?
Really good. I love it. I love it. My students are excellent. I really enjoy helping them. Really develop their coaching skill set, and just like helping them understand the body in a whole different way. Because a lot of them have come from sporting backgrounds. So I've actually taught in a couple institutions in the past couple of years. One of them, they were more from Australia, but the institution I'm teaching you now, they're actually more for international students. And
Amazing.
when I say international students, like they are very educated people. Like most of them have got bachelor's degrees, and some of them are in their early to mid 30s as well. So they're actually quite articulate with how they speak, and they're very educated. And you wouldn't even think they're international students. It's actually really really good, and I really enjoy teaching them. I get a really good I get really good feedback from my students. They love what I teach, and they can see how passionate I am about health and human movement, and just how to understand the body a bit better. And what I like to say, train smart and not hard. They really grasp it, and it's getting to the point now where I'm getting messages from students from other classes who want to come into my class just to listen to me speak. Like
I love that.
they don't care about attendance. They just want to hear me speak.
Yeah,
So
and it's
I
because they
mean,
can tell that you're passionate about it, right? You're so
yeah,
passionate about it, they can sense it, and they're like, "I just want to be there. I just want to listen to what he's got to say." He's done the
yeah.
latest research. He's passionate about it. But there's a tagline that you said in there: "Train smart, not hard." Expand on
Mm.
that a little bit. Tell me.
Okay. Well, let me
Let's
just
get
get warmed
into
up.
it.
Let me just get warmed up. Let me just get warmed up. So train smart, not hard. Where did I get that from? So obviously the past probably have what now 15 years. Okay, well, so growing up my entire life, I've played sport my whole life. I played tennis, fairly high level, traveling around Australia, playing tennis tournaments, doing squads, comps, private coaching, all that sort of stuff. And I also played footy as well. I played footy at a pretty good level too. Um, so all I heard growing up was you have to do more, 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 more. You want to be fit, run more. You want to do this more. You want to do this more. And then when I was 18, 19, I transitioned into my martial arts. So my Muay Thai kickboxing, my BJJ, which I still do. I'm just kind of in the off season at the moment. I kind of go back and forth. Um, but even in the martial arts, all I heard was train more. You got to do more, do more, do more. Come in here. My coaches, even now, they still bust my balls. Come every day. You got to train every day. Come every day, 3 hours every day. And it's like, no, no. And, back in the day, one of my coaches said to me, because I used to try and alternate one day MMA, one day gym, one day MMA, one day gym, because I like to lift weights. I knew there was a purpose to it. And then he was like to me, yo, you don't have to lift weights. That's all rubbish. I'm just like, yeah, okay. But back then I wanted to lift weights just to look good. I didn't know a lot about how the physiology worked and all that sort of stuff. And he was just like, yeah, no, don't worry about weights. Just come here every day, train every day. And it's like, no. Anyway, so obviously throughout my education and my career and everything, what I know now compared to what I knew back then, I knew there was something in me. I was on the money that you shouldn't be training all the time. So when I say train smart, not hard, it's about understanding how to apply the right training stimulus within a certain time frame to get the best results, and so you can avoid injury, overtraining, and various other issues. But the main two things are increasing performance to a really good level and reducing injury. Those are the two things. This is why we need to train smart and not hard. When you train too hard, too frequently, the risk of injury significantly skyrockets. And you being a naturopath, you obviously would know about the hormonal alterations that occur if we're under eating or if we're overtrained. Like you talk about your cortisol levels and your how that can completely skyrocket, and how that affects our ability to recover from a stimulus. So all these things come into play. And if we look at some of the research in terms of like there's a thing called the general adaptation syndrome, how, like, for layman's terms, we got to put a stimulus on the body, then the body then has to rest because all the recovery happens when we're resting. So when we learn to maximize that general adaptation syndrome, this is where we get all the gains. All the gains happen when we're resting. This is what people need to understand.
Scream
The
that
ga-
louder.
the gains don't happen. I can't scream because then my neighbors will crack the shits at me, right? 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 But all the gains happen when you're resting, not when you're training more. People think
Yes,
if you go to the gym
yes.
and you get a pump, I'm getting more gains. No, you're not. No, you're not. You're just increasing fluid volume in the muscle cell. Okay, you'll get gains for a short time because we know from some of the studies, if you go to the gym and do a lot of volume, we do get muscle hypertrophy for a short amount of time, and then it obviously goes down. This is why I rant about what's true muscle hypertrophy. But the point of it is, all the gains happen when you're resting, and when you train smart, this is when you can really maximize everything. But it doesn't have to be muscle; it can be cardiovascular as well. Cardiorespiratory fitness also occurs. People got to understand that adaptation, or how the body changes, it's globally. It's not just one thing. The body changes as a whole when you go to the gym or when you train. It's not just, oh, I'm going to just try and get muscle hypertrophy. Well, no. Do you know how many other things come into that? It's not just one thing. But that's the concept of train smart, not hard. Understand how to apply the right stimulus at the right time to maximize the result and to reduce the risk of injury. That's why we train smart and not hard. I don't know about you, Mahela. Sorry, so I'm ranting now. See what
No, no,
happens.
no, you're not ranting
You
at
get
all.
me
No,
on
I
a,
love
you
that.
get me on a, you get me on a
No,
thing.
no, I love it because
Yep.
you saying train more, train harder, go. It's like that's just been drilled into us. No matter what sport you do, no matter what training you do, or any athlete you talk to, they're like, "Yep, I got to be there. I got to be there every day. I got to smash out 6 hours. I got to do 2 sessions." And it's like, wow, let's just hold back a bit. Let's look at the research. Let's look at how the body actually works. And do you want injury? What's your goal? Is it performance? Is it, and it's like, we need to rest. This is where
Yeah.
key happens. And this is
Yeah.
where sleep is so important for muscle growth. And anyone ever talks to me about getting strong or something, sleep, and they're like, what? And I'm like, yes, you need to sleep.
Also, as you would know, sleep is the number one fat burner.
Yes, yes.
And people say to me, "Oh," they say, "What supplement should I take for fat loss?" I go, "I've got the best supplement for you." I go, "It's called your pillow and your blanket." They
Yes.
go, "What?" I go, "You got to sleep. Sleep is the number one fat burner." But people, it doesn't register because they think they get sucked into all this stuff on social media about take this fat burner, it'll make you shredded. And obviously, it's in the name. Like they got something shred in the name of the fat burner.
Yeah.
It's like, you know what I mean?
I mean, if it's got shred in the name, of course it's going to do the job properly, right?
No, yeah, of course, 100%, 100%.
I love that. You mentioned true hypertrophy training or true
Yeah.
muscle hypertrophy. What is that?
Okay, so this is something else I went on a rant about the other night, actually had a good reception. Anyway, so what's muscle hypertrophy? So hypertrophy means something getting bigger, like a cell getting bigger. But there's two things we've got to think about here. Number one is hypertrophy, which is what I just spoke about. But the second one is what we call hyperplasia. Have you heard the name hyperplasia before?
Yes.
So hyperplasia means the cells inside the cell also getting bigger. And we call these hypertrophic responses. So hypertrophy and hyperplasia happen together, and we call these hypertrophic responses. Now, what's true hypertrophy? So let's just take a look. Let's just take a step back and have a look at the way the fitness industry has portrayed hypertrophy. Okay, so for whatever reason, it's drilled into people. The reason why you go to the gym is to build muscle and to lose body fat. All
Correct.
right. Well, let me tell you something. Those two things are byproducts to the exercise stimulus. So what does that mean? That means they just happen when you apply the correct stimulus. When the training program is adequate and the procedures are perfect, and obviously you're getting the right calorie intake, your sleep is perfect, you're managing your stress, the muscle gain and the fat loss, they just happen. But for whatever reason, I think it's because we are human beings and we value the physical appearance over everything else. All right. We think all we have to, we go to the gym just to look good. We want to just, oh, I can look good in a tight t-shirt. Oh, I'm going to Mykonos in 2 weeks and I need to look shredded. All right. This is why people go to the, 85% of the reason why people go to the gym is to increase muscle mass and decrease body fat. We don't train for those two things. Why do we train? We train to improve our strength, improve our speed, improve our power, improve our nerve health, bone health, joint health, ligament health, and all of that makes us run faster, jump higher, change direction better, reduces our risk of injury, and it improves our overall quality of life. All of a sudden, all the daily tasks that we do become easier, right? Getting shopping out of the car becomes easier. Putting something in the top cabinet becomes a lot easier. Oh, you got to move this couch for whatever reason. Oh, I'm doing deadlifts now. This doesn't feel that heavy anymore. Right?
Yeah,
This is
yeah.
why we train. And I say to people who are stuck in this, oh, I have to look good phase, going back to the caveman days, do you think they cared about how big their biceps were? Do you think they cared about how big their chest was? Nah. You know
Mm.
what they cared about? How do I get strong enough to pick up this cow to bring it back to the village? That's what they cared about, right? But now, obviously, as time has gone on and we are where we are, I blame two things for why we only think we have to go to the gym to get more muscly and lose our fat. Number one is the bodybuilding industry. That's what they've done. And number two, I blame social media because everything's about image, right? Now,
Yes.
being a personal trainer myself for many, many years, I still am. All I heard was, um, your body is your business card. Your body is your business card. Don't worry about the
Wow.
five. Don't worry about the 5 degrees that I have. Don't worry about that. Don't worry that I got don't worry about I got doctor behind my name. Don't worry about that. Don't worry that I can deadlift almost 3 times my body weight. Don't worry about that. How does he look? Does he have a six pack? Does he have 40-inch arms? No, but I can still outperform most of the dudes who have that, right? So those two industries have made people think this is how I have to look. This is how I have to look. Now, obviously, I've gone on a big tangent, but bringing that back to muscle hypertrophy. So, what's true hypertrophy? Have you seen a guy on Instagram? His name's Anatoly.
No.
He dresses up as a cleaner and he walks around. I'll send you
Oh,
some
yes,
videos
yes,
after
I
this. You
have.
have
I
seen
have
that?
seen it. Yes, I
Okay.
love those videos.
Okay.
That's the
So
best. Yes.
you can see how the dudes that he's outlifting are literally double his size.
Triple sometimes. Yeah, they're
Triple
huge.
his size.
Yeah.
They're massive. Okay. So when I talk about true hypertrophy, I'm talking about more on in the sense of muscle hyperplasia. So the organelles inside the muscle cell, the contractile elements increasing inside the cell. That is true muscle hypertrophy, right? So for many years, it was so the coaches for the past 40 years or so, it was theorized that bodybuilders, when they do a lot of high volume and low rep, so a lot of lightweight and high rep, that they get more what we call sarcoplasmic hypertrophy, which is when the muscle cell size increases but doesn't include those contractile elements, right? So the muscle just looks fuller, or the pump, so to
The
speak,
pump.
right?
Yeah. Yeah.
And then they were trying to figure out, well, why are these powerlifters so much stronger than these bodybuilders, and they're literally half the size? And then there was theorized then, oh, well, they've got what we call myofibrillar hypertrophy. So the myofibrils in the muscle cell, they contain their contractile elements like your actin and your myosin filaments, and they're responsible for producing force when the muscle contracts. So when the muscle shortens, they cross over. When the muscle lengthens, they spread further apart. And then obviously based on the position of the arm or the muscle determines how much force the muscle can produce. So it was then postulated that, okay, well, powerlifters have more myofibrillar hypertrophy because that's really the only way they can lift so much weight. Also, the fact, they've got different muscle fibers, which we'll get into a second. So what we are now starting to really understand, and there's been some papers that have come out about this recently, um, is that this sarcoplasmic hypertrophy and myofibrillar hypertrophy thing, it's probably a thing. Like, it's actually probably a thing. There's actually been 2 or 3 studies that have come out in the past couple of years that have shown that, especially one of them in particular, the people who did 10 weeks of high volume training, so reps of 10, squat, bench, and RDLs, I think it was, or stiff leg deadlift, reps of 10 at 60% 1RM, they gained a ton of non-contractile hypertrophy. So what that mean was their sarcoplasmic volume increased, so the muscle did get bigger, but the contractile elements didn't change. And they've now shown that a couple times from like muscle biopsies and various other forms of evaluation methods.
So
Now,
for the audience listening, you
yep,
said 60% of one RL
RM.
P was it? RMs.
So,
So what does that mean for
so
the
what that means, let's say for example, Mihaela, you go to the gym and you do a squat.
Yes.
So one rep max, that is the maximum amount of weight you can lift, right? And that's
Yeah.
100%. That's 100%. So if you go to the gym and you get a bar, you do a back squat, some of the best strength and conditioning coaches in the world, they say your 1 RM should take about 5 to 7 seconds to finish. So you just imagine how long that is when you've got a ton of weight on your back.
Yeah, that's
All
a
right.
lot.
So that's a ton of weight. So they say, so in this study, they did 60% of your 1 rep max, which is fairly lightweight. That's literally, that's almost half the weight,
Yeah.
which is technically like a warm up set for some people.
Yeah.
Um, so they did that for 10 weeks, I think it was, or 6 weeks. And yeah, they found a significant increase in muscle size, but the contractile elements didn't change. So the muscle
Yeah, so
got
it
bigger.
wasn't heavy. So it wasn't heavy lifting. It was more. It was lighter lifting. So not your
Yep.
max,
Yep.
and you did about only 10 or so, and then your muscles grew, but your strength didn't grow. Is that correct?
The strength did increase a little bit,
Okay.
but it was, I think they said it was statistically insignificant,
Yeah. Okay. Yeah.
right?
Yeah. Yeah.
But they did see a larger degree of muscle hypertrophy. But again, it's
Okay.
like the hypertrophy, but the muscle cell just got bigger. Like the contractile
Yeah.
elements didn't change. So, and then there was another one when they compared again recently. I think it was 2022 they did this one, um, where they looked at again. I think this one was 6 weeks, and they looked at the quads, high volume, so high rep and low weight, and high load, so higher weight and low rep. And
Okay.
what they found was, again, the higher volume had much larger non-contractile hypertrophy, so the muscle size did get bigger, um, compared to the group that did heavier weight. But the group that did heavier weight had more strength gains, far more strength gains than the group that did more volume. Right? So it's like, okay, well, again, it's again more confirmation here, but this is now something I got to explain as well. So, true muscle hypertrophy takes literally about 10 to 20 weeks to happen. Some studies have actually said true hypertrophy takes about 20 weeks, depending on
Wow.
the stimulus, right? It's a long time, okay? But the
About 5 months.
problem is,
Yeah. Wow.
yeah, but the problem is, right, a lot of the studies that have been done, and my lecturer in my master's degree actually said this repeatedly. This is one of the limitations of a lot of scientific literature, is that the studies are only done for 10 weeks. You
Yeah.
might get
Okay.
you might get some that are 15, but we don't really see a lot of studies that are 20, evaluation of muscle hypertrophy in 20 weeks or evaluation of muscle hypertrophy in 30 weeks. If there are, there's not a big handful. So a lot of the studies that you've probably read too, Mihaela, are 10 weeks
Mm.
or 6 weeks or 8 weeks. Now, this one study where they did heavy lifting, so the programming was actually spot on. They did very heavy weight and very low rep. I think it was like reps of 3 to 5. Now, they
Which is
wanted to
unheard
look.
of when for most people that are listening are like, I've never gone
Yeah,
to the gym and only done 3 reps.
no,
You know, we
no,
usually do 8, 10, 12, the 12, the usual 12, the
12.
standard
Yeah,
12.
but Mihaela, you got to understand something. I'm going to make sure I say this because I've had a lot of heated discussions with a lot of coaches and practitioners about the things I say. What I say, I'm not making up. What I say has come from somewhere else. So whether it's the literature that I read, the books that I read. So I've actually got a book in front of me right here. I'll
I
just
love
I'll just
that.
put it up. Every strength and conditioning coach has to read this.
And what is it
It's
called?
it's called Strength and Conditioning for Sport Performance. It was written
Beautiful.
in 2021. Absolutely fantastic, right? Anyway, things that I say come from somewhere else. I don't just wake up one day and say I'm going to spread this today, right? It's come from somewhere else, and they're normally very reputable sources. Evidently, look at that book; it's like that thick, and the writing's like
Yeah.
this big. All right. Now, this recent study that came out, yeah, so they did reps of 3 to 5, very heavy, and they wanted to see if the heavy weights, because it was theorized again that the heavier loads stimulated the myofibrillar hypertrophy. So they wanted to see, well, does heavy weight stimulate myofibrillar hypertrophy? And again, it was only 10 weeks. All right. So what they saw was type 2 muscle fibers significantly increased in the group that did very, very heavy weights, which I'll talk about the muscle fiber types in a second. Um, but what they saw was, again, statistically insignificant changes in myofibrillar content. All right. So there wasn't enough of a change in 10 weeks to say, yes, heavy lifting increases myofibrillar hypertrophy. But what was very interesting was they found was the actual actin and myosin filaments per myofibrillar reduced. And they
Okay.
postulated the reason why that happened, they postulated, was due to this other thing called myofibrillar packing. Have you heard of myofibrillar packing before?
No,
So
tell us
what
about
it
it.
so what it is, so you can imagine, so myofibrillar hypertrophy is the myofibrils getting bigger, right? Myofibrillar packing is, or suggested to be when the myofibrils increase in size, but then they get too big and they split into two. Make
Okay.
sense?
Yeah.
So hypertrophy, myofibrillar hypertrophy is suggesting that the myofibula is getting bigger, or in most cases also getting longer, right? Which we see in most eccentric contraction-based training. The myofibrils can actually become a lot longer. Um, but myofibular packing has been suggested when the myofibula grows, it gets too big and then it splits in half. So in this paper, they said the reason why potentially actin-myosin filaments have reduced is because of the myofibrillar packing content, which they didn't really look
Okay.
at. All
Yeah.
right. Now, that happened in 10 weeks, but they did see a very, very small increase in myofibrillar hypertrophy. Very, very small. But who's to say that wouldn't have been far better if they looked at it in 20 weeks
Yes.
with this program? This is why people are saying true muscle hypertrophy takes 20 weeks to happen. But again, you look at society, people want results like this. All right, they don't want to train for 20 weeks. I'm going to Europe in 2 weeks. In 3 weeks, I have to get jacked. It doesn't happen.
Yeah. Yeah. I don't want to be
Doesn't happen.
strong. I don't have to lift anything in Europe. I just have to look good.
Literally. So then I see people say to me, "Oh, but I want to look good. I just want to wear a tight t-shirt. I just want to look good." Yeah, but like, what for? See, like, okay, you want to look good. Everyone wants to look good. We all want to look good. But the problem is, you want to be able to function well.
Yes.
You are a
Yes.
human being. The human being, right? One of my favorite sayings is, um, "You are a product of your environment." Right? So what you do, the body will change. If you want to sit all day, the body will change. It will change to that, right? If you
It
don't load
adapts.
the,
Our body
it,
adapts. It's
it
beautiful
does.
at adapting.
It does. So I've been doing some other stuff because I've got a big project coming out in the next few weeks. Um, it's funny because like with the human skeleton, if we don't load it, the body purposely breaks down bone because
Yeah. Wow.
it doesn't need it. It doesn't need it.
Yes.
Same now we're starting
Yes.
to learn with the cartilage. Again, the cartilage. I'm telling you now, some of the stuff I learned about the cartilage and osteoarthritis back at uni, what I know now, completely false. Completely
Wow.
false. Um, what we're
Tell
starting to know
us.
now, what we're starting to know about osteoarthritis in particular, the cartilage. We're seeing more osteoarthritis cases in people who are sedentary, so people
Yes.
who don't train. We're seeing more cases of arthritis, or people who overtrain, which is obviously like you're obviously putting too much load through the system. But this whole thing about cartilage being a wear and tear thing, that's not true. So going back to the body adapts, as you would know, Mihaela, it takes a lot of energy. Like if you think about how much energy it takes to maintain certain muscle mass or certain physical aspects of your body, it takes a lot of energy for that. So if the body doesn't need it, it won't keep it. Just like with bone mineral
100%.
density, it takes a lot of energy to sustain large amounts of bone mass. If the body doesn't use it, doesn't need it, it won't keep it. It won't keep it. This is why you see so many athletes. I think they did another study where they looked at athletes' bone mineral density, and when they were an athlete, the bone mineral density was fantastic, and then when they stopped performing and stopped obviously competing, you could see the bone mineral density start to completely reduce because
Wow.
it doesn't need it, right?
Yeah. Yeah.
So it just goes back to, in my mind, people think we've got a lot of time on this planet. Let me tell you something. We really don't. I've been to two seminars in the past 3 4 weeks, and both of them had this graph on this 10 by 10 graph. And when you actually break down how long we have, it's not very long. All right. And there's this thing. There's a guy called. I'm sure you've heard of him before. His name's Dr. Peter Attia. He uses this thing called your life in weeks.
Yeah, wow. Yeah, no. Yep, yep, yep. I
All
just
right.
freak out when I see that. I'm like, okay,
Everyone does.
close.
Everyone does. Everyone does, right?
We are immortal.
When you cross off how many weeks you have, you just or how many weeks you've had compared to how many you have left, it's like,
Yeah.
oh my god. That's what I mean. So in my head, we don't have a lot of time on this planet.
No.
So it's like if I'm gonna go to the gym, I'm gonna train properly. I'm going to get stronger. I'm going to get fitter. I'm going to try to improve myself as much as I can, rather than just going to the gym just to get a pump, just so I can look good. Who
Yeah,
cares? How is that going to affect how you function as a human? That's the most important thing.
100%.
And something else people have to realize is when you go to the gym, when you train properly and you develop better hypertrophy, or you get more functional strength, or your fitness increases and everything else, all the gains that happen, they will hang around longer.
Mm,
Whereas if you just go to the gym just to get a pump, the gains won't really hang around that much longer, because it's just water. So it's this sarcoplasmic hypertrophy thing I was just talking about. What it is, it's an increase in blood, water, and glucose content, and that fills the muscle cell, makes it look fuller. That's what it is.
mm,
So
mm, mm.
this is a very big tangent, but this is the concept of true muscle hypertrophy versus muscle hypertrophy that just it's not functional, it just looks good.
Yeah, no, I love that you shared that with us. Absolutely.
Mm.
And jumping on that about, longevity and how many weeks you've got left. I mean, most of the research studies that I've read, one of the key indicators for longevity, which they keep talking about, is muscle, right? Muscle strength is our muscles. And it's like, okay, well, if the research studies say that, the more muscle we have on us, the longer we have to live and the healthier we live. It's not about living longer, but it's also living healthier. And like you mentioned, is about, taking the groceries out. As we get older, how important strength training is so important now, but the older we get, it's even more important from what I've read. And it's like most of those falls that individuals have, most of those pains, most of the inflammation, most of those arthritises, it can be I guess minimized with strength training. And it's like I was talking to my mum, and she's in her 50s, and I was like, you need to lift, mum. And she's like, what are you talking about? I'm like, mum, you need to lift weights. Like, you need to go to the gym. I bought her some of those weights, those dumbbells, and I'm like, you need to lift. And it's just crazy getting that concept into her head that she needs to lift.
Yes, 100%. So let's just branch off this for a second, okay? So
Yeah.
so we've just spoken about the different types of hypertrophy, but now let's talk about how the muscle fibers change. Because this is one of the biggest things we need to consider. So as we age, okay, so like I said before, we're a product of our environment. Okay, we are a product of our environment. What we do, the body will change. Now, you think about when you're younger, right? When you're younger, what do? You're always active, you're always out, you're always running or jumping for whatever reason it is, right? But then, in your experience, Mihaela, what happens at about 25 to 30 years old for most of the population? What happens?
They get
Like
a
in
corporate job and they sit.
exactly right. Hit that you spot on. Okay. So what happens is they stop moving, they get a corporate job, and they sit. And then after they go sit at their job, they call their mate, oh, let's go for dinner, or let's go for coffee. And what do? You go and you sit. And then
Yeah.
after you go catch up with your mate and you go home, what do? You sit and you watch Netflix. And then after that, what do? You go to bed and you sit/lay down.
Yeah.
All right. So look at the transition from, we'll say, 21 years old to 30. All right. That time frame. Now, what we're seeing is from some of the research is after the age of 50 for men, I think it's a bit earlier for women, is we see a decline in type 2 muscle fibers. So we got really, what, 2 to 3 types of muscle fibers. Well, really two, but like two and a bit. So how it works is this: we got type 1 muscle fibers, which are slow oxidative fibers. We have type 2A muscle fibers, which are what we call fast oxidative. And then we have type 2X, which are fast glycolytic, right? So slow muscle fibers, type 1, they're red in color, got really high myoglobin content, mitochondria, and capillary density. So they're very fatigue resistant, especially when it comes to long distance stuff, right? Now, type 2A muscle fibers, fast oxidative, right? They've got a moderate amount of myoglobin, capillary density, and mitochondria, but they've got a really good ability to produce fast contractions and high amounts of force. But the fast glycolytic, the type 2X fibers, they have very little myoglobin, mitochondria, and capillary density, but they can produce very, very fast contractions. They've got a very good motor neuron, and they've got a very fast, what we call myosin ATPase. So their ability to contract is like super, super, super fast. But they fatigue very quickly, right? Like super, 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 super quick. So you think of like sprinters, for example, right?
Yeah.
Um, Now, when we do strength training, the immediate adaptation that happens. So normally, if you don't do anything, we've got a mixture of these muscle fibers. We've got a mixture of type 1, type 2A, and type 2X. All right. So when we do strength training, we get an immediate shift from type 2X to type 2A. That's the immediate shift. All right. But then the type of training that you do will dictate which muscle fibers do you develop more. So when you do more heavier training, more like powerlifting type training or more weightlifting type training, like we're talking like working between 80 to 90, 95% of your 1 rep max, so
Yeah,
really
wow.
heavy loads, we develop more type 2A than type 1. We still get type 1, but we get more type 2A. People who do more bodybuilding type training, so we're talking like very low weight or low to moderate weight, doing sets of like 10 to 15 reps, so your high volume stuff, we get more type 1 than type 2A. We still get type 2A, but we get more type 1. All right? Now, this is a problem for longevity
Okay.
because when we get older, the type 2A muscle fibers reduce, or the type 2 muscle fibers in general reduce, right? That's the thing, like people argue, well, is there 2 or is there 3 muscle fibers? Well, there's 2 types of type 2, you know what I mean?
Yeah.
Anyway, so when we get older, type 2 muscle fibers in general decrease significantly and type 1 increases. And type 1, you move slow, they don't produce a lot of force. Yeah, okay, they're fatigue resistant, but they don't really help you in terms of movement. So the way we
Yes.
need to train type 2 muscle fibers is fast and heavy. Those 2 things. So this guy called Pavel Tsatsouline, one of the best strength and conditioning coaches in the world, he said, and I quote, he said, if you want to stay young, you need to train heavy and or you need to train fast. Because people do this super slow this and Pilates that. He's like, it's not going to do it. He's like, if you want to stay young, you need to train heavy and you need to train fast. And there's considerable amounts of evidence coming out on this. But even then, like on Instagram, there's a bunch of videos of you get like these 80-year-olds who are deadlifting 180 kilos for
Yeah.
two. One of my
I've
one
seen
of
that. It's crazy.
one of my patients currently, he's 65 years old. He's one of the High Rocks champions, like world champions.
Yes.
65 years old, and he's showing up 30-year-olds. So while these 30-year-olds are vaping and playing video games and binge watching Rick and Morty, right? This 65-year-old is completely outperforming him, right?
Yeah,
So
yeah.
so this is what we have to start thinking about. Now, this is the problem. Okay, so let's go back to this corporate job. So people are like, you're in a corporate job. Oh, I need to get healthy. I need to get moving. Okay, so what's the first thing they do? They go to the gym. Excellent. You've made the initiative to get off your ass and go to the gym. Fantastic. Okay, but then what do? They slow jog on the treadmill. They use the cross trainer and they jump on a machine and they do light weights and they pump out a bunch of reps because they think I want to feel the burn. Right? So to them, they feel the burn. But then what happens is, based on the conversation that we had half an hour ago, right, they get immediate results in muscle hypertrophy, but because they think, oh, look at this muscle, I'm getting more muscle, oh, I must be getting healthier. Okay, well, first of all, yes, you are getting healthier for going to the gym, but now it's more about, well, hang on a second, what type of adaptation are you promoting? But obviously, they don't know any better, right? Because they're
Of
they're
course.
corporate, they're corporate, but they do these high volume and low weight for multiple years. They run slow for multiple years, or they power walk, or they do what they want. It won't help with increasing or having more type 2A muscle fibers or fast twitch muscle fibers. Won't help. Won't help. This is my issue with Pilates. I've got a big problem with Pilates. I'll tell you who it's good for. I'll start with the good things first. So
I love that.
Pilates, Pilates is good for people who have never done anything before, who need something. Beautiful. Pilates is good for like early rehab. Like it's good. Just get them on the thing on the bed. Just get them moving. Um, it can be good as well for pregnancy or post pregnancy. Fantastic, and it's good for building a community. Excellent. Those four things. Fantastic. Can't fault them. But let's talk. Let's refer this now to what I just spoke about. I've worked in clinics now for 5 years, and every clinic I've worked in has had a Pilates section or exercise rehab section, but that's just been like a bunch of Pilates beds, right? And I watch how these people do this stuff. Everything is slow, everything is light, everything is time under tension, but the weight is so low,
Yeah.
right? That is not going to help build type 2 muscle fibers. The stimulus is not high enough. So people think putting somebody on a Pilates bed is going to help with longevity. Maybe. I mean, you're getting them moving, but it only produces what we call the minimal dose response, which is literally if this is I've got no strength, right? If this level's I've got no strength, it'll bring them to there. And then after that, there won't really be that much more. So then you think to yourself, well, what do I have to do from here? Oh, well, you got to put a higher stimulus on that. Oh, so what's a higher stimulus? You can't do that if you're laying down in the bed. What do you have to do? You got to pick up a barbell or a dumbbell or something of that nature, a heavy kettlebell, to then bring the strength up to here. Now, if we're talking about longevity, right, we could talk about bone health for a second. It is clear from the literature currently that machine-based training does not do much for bone mineral density. Again, it'll probably give you a little bit, but that is it. So bone responds primarily to axial compression. So when the load is pushing down on the skeleton, that is when the bone really responds. It does respond to a bit of the muscle tendon pulling on the bone, but in very small margins. There's been a bunch of studies done when they've done machine-based training, heavy, and there's been no bone mineral density changes. But the studies that they've looked at with bone, where they've done heavy squats, heavy deadlifts, heavy overhead press, anything with a barbell that applies axial compression, the bone mineral density in the lower back and just in the whole body, but specifically in the lower back, because in the lower back we've got more spongy bone, which is more adaptable. In the lower back and in the hip, the bone mineral density significantly increased. So
Wow.
now if you talk about longevity, well, elderly people think putting them on a reformer bed is going to help them. Well, not really. Like, if they're brittle, we need to build more bone. We need to put,
Mm.
in conjunction with pharmacological
Yes.
interventions and, nutritional interventions, we need to load them axially. Right? We need to put them under a barbell. We need to make them deadlift. We need to make them squat. We need to make them pick up dumbbells. Anything that requires axial compression. Unfortunately, a Pilates bed just won't do that. So,
I,
if we're
I
talking, if
love
we're
that.
talking longevity, sorry to keep ranting, we're talking
No, no, no,
longevity.
no. I love
We,
this. I love where you're
right?
going with this. This is
We,
exactly the stuff that I strongly believe and I've read and the research says. So I love to
yeah.
have you on here. Keep talking. Yes.
In terms of longevity, the two things we have to do, you need to train heavy, you need to train fast, and you need to have primarily free weights. Primarily. There's another whole other topic I can go down about how to swap them around, but that's a whole I'll be talking about that for 3 hours. But the main message here is if you want to have a better functioning body, you need to train heavy, fast, and primarily with free weights. This is important. And also, you need to know how to periodize your training. You need to know when to push the body and then when to have a deload week. When to push the body and when to have a deload week. And what we actually
How do you
started,
know? How do you know?
well, again, like it's one of those things where it's one of those things where, um, believe me, like subjectively, I know when I need a deload because I'm just physically exhausted.
Yeah.
All right. But there's actually some research coming out now when they're talking about desensitization and resensitization of tissues and about bone in particular. Like they say, we actually have to unload the skeleton after periods of loading we need to unload the skeleton for a couple of weeks and then reload it so the bone can then resensitize to the stimulus. Because if you just keep
Love that.
applying, if you keep applying progressive overload on the skeleton, the actual adaptation of the skeleton will be slower. All right, so that's another important thing about deload weeks. There's actually some research coming out now about the actual muscle tissue. So you know how in the muscle our ability to make protein comes from our RNA and DNA, like transcription, translation, all that stuff. So what they're saying is they actually did a study where they looked at the ribosomal kinase at week 1 of the program, and then they were doing muscle biopsies where they looked at it throughout the 10-week program, and they found that the ribosomal kinase activity was declining throughout the program. So what that means is um, if you didn't give the muscle a chance to have a rest, their body's ability to make protein was slowing down.
Wow.
And then when they took a break, when they took a break and then they retested it, the first week back of their break, the ribosomal kinase then spiked back up again. So this is another reason why we need to deload. Deloads are very, very, very important. This comes under the umbrella of training smart and not hard. Like I said,
Yeah.
all the gains happen when you're resting, and all the fat loss happens when you're resting too. So people who are listening to this, if you want to lose fat, you need to rest. You need to give the body a break. I've actually had a couple
Yeah.
of clients who have gone overseas, and they haven't been training, right? But they've been eating a lot more, and they've lost a lot of body fat. They go,
Yeah.
how am I losing weight? I'm like, well, because you're resting and
Yes.
because you're not
That
stressed,
always
and
happens. It's
yeah,
amazing.
yeah,
Yes, yes, yes. A hundred
because
percent.
you're resting and you're not putting high stimulus on the body, and because your cortisol levels are lower, you're eating more, which means when your cortisol levels are lower, you're more in a fat anabolic state. Correct me if I'm wrong. This is obviously more your field of expertise, but from what I know, I've heard cortisol is a fat anabolic and a muscle catabolic. So if the cortisols are too high, your ability to lose fat will significantly decrease. But if your cortisol is lower, then your ability to lose fat will be far better. Hence why we need
A
sleep.
100%. 100% on point there. I love that.
Hmm.
Yeah, wow, you should just shared some absolutely amazing information with us about longevity, and muscles and how to train and deload and how important actually like rest is. Like we don't actually think about it and how important it is to lift heavy. I think there needs to be like a whole cultural change in regards to lifting. And we can talk about a whole other topic, even with women lifting. I read a research study the other day and it was like why women don't lift as much. And it's also because of the conception of just going into the gym and using the free weights. It's mainly men there. And some women may feel, a bit awkward doing it or feel like they're going to get judged or whatever. But it should be normalized that you can just get the barbell and go for it and lift. And it's totally normal to do that. And then you go to Pilates, and it's mainly women. There's not that many men. It's quite interesting. Whereas, lifting and strength training for women is so important. And it depends on their cycle, and it can work with that and so many other things. It's like a whole other podcast. But I'm always such a strong advocate for women to lift and lift very heavy.
Look, I think it's definitely become a lot more normalized now. Um, a lot more women are lifting now, which is really good to see.
Yes.
I do also think it's still in the back of females' minds of if I lift too heavy, I'm going to become too bulky and I don't want to do that. Well, I will tell everybody now, especially all the females out there now, and not 95% of my clients were females. I will tell you now, factually, you cannot get big and bulky unless you take steroids. Doesn't happen. Okay. Every female, people say to me, should men and women be trained differently? No, they shouldn't. No, they shouldn't. What for? Biologically, females have more type 1 muscle fibers than men, which is an evolutionary thing because we're the hunters and the gatherers and the females are the nesters. So we needed the type 2 muscle fibers we needed the strength to bring the food back to the village. Right? So from an evolutionary perspective, this is just how it is. And really our DNA hasn't really changed at all, to be honest with you. But women still need strength. They still need to challenge the body because your body is an adaptable fabric. It's what it is. I love when people say, oh, I'm a power lifter, oh, I'm a bodybuilder, oh, I'm a weightlifter. No, you're not. You're a human being. Powerlifting, bodybuilding, and weightlifting, they
I
are
love
just
that. I
they
love
are
that.
just stimuluses. They are stimuluses to the system. They're just different stimuluses, and the body will adapt to the stimulus. It's as simple as that. People make this so complicated. It's not that hard,
Yeah.
right? It's just bizarre. And how complicated people make it. It's really not that hard.
Quite simple. There's one paper that I want to talk about, and a lot of people talk
Mm-hmm.
about injuries and
Mm-hmm.
they're scared to get injured and so forth. But I know that you were one of the first osteos to get published paper in the Journal of Australian Strength Training Conditioning, where
Mm-hmm.
you wrote a paper on knee valgus. Can you just run through that a little bit?
Ah, that's my
Um,
favorite topic.
yeah, I know we could do
So,
a whole. We could do a whole. I know we're
oh,
running out of time shortly, but I
that's
just
okay.
thought I
That's
wanted to
okay.
put that in there. Tell us a bit about that, Andrew.
That's my favorite topic. So I'm actually going to be talking about this paper. I'm going to be presenting at the Osteo conference this year, and this is
Amazing.
and this is what I'm going to be talking about. One of my favorite topics. Um, this is like this knee valgus and knee injuries thing. This is like it just finds its way to re-emerge itself back into social media. Once we like break it down, somebody else just wakes up one day and says, and they have a feeling, oh no, but it does this, and then the whole cycle starts again. It's like an Instagram cycle. It's like, oh, knee valgus is safe, and then it gets broken down. Oh, knee valgus is safe. Oh, then it gets debunked. Oh, knee valgus is safe. Then it gets debunked. So what it is, right? In the muscle tissue, we have what we call a stress strain curve. Okay, so every human being is built differently, right? We've got different thicknesses of cross sectional area, and most of the time, if something's bigger in cross sectional area, which means like for example my tendons might be bigger than yours, which means it's bigger cross sectional area. So theoretically, my tendons can handle more stress. Okay, so when we talk about cross sectional area, this is a problem where people relate poor technique to not getting injured. Because it's like, well, this person had bad technique. How come they're not injured? Well, maybe because they've got more cross-sectional area there. But the thing is, to develop good cross-sectional area in a tissue, you need to train the body in an optimal position. This is how the body adapts effectively, right? Otherwise, you're going to be injured. And then when you're injured, you can't train. Then all these other things happen. So when it comes to knee valgus, right, there's a thing where, so first of all, what is knee valgus? Knee valgus is adduction of the knees. So when your knees cave in during a lower body movement, and it's primarily associated with two or three things, mainly restricted ankle range of motion, so dorsiflexion of the ankle, weak core, and weak glutes, or weak hip external rotators, if you want to go deep into the anatomical terms. So what happens is when our knees cave in, the risk of what we call patellofemoral pain significantly increases. And also because of the movement as well, people who have had a history of ACL injuries or just any medial knee problems, that can then exacerbate those symptoms, and they're potentially at a risk of re-injury, right? So what they've found was, especially in women as well, a lot of, if your knees cave in when you're doing any lower body movement, whether it's a lunge, a squat, or hopping, or whatever, or landing, especially landing, if your knees cave in, then your risk of patellofemoral pain significantly increases, and then that will affect how you perform every other activity. And also they found that the females who came back from an ACL reconstruction, their risk of re-injury from excessive knee valgus was significantly higher than people who weren't having any valgus within their movements. And they also found in one study in particular that the women who had patellofemoral pain and they had knee valgus, so their knees were caving in, their pain significantly increased. And then when they fixed the alignment and they did the same exercise, their knee pain went away. It's crazy. So
That's
in terms of
insane.
knee valgus, again, I understand where people's heads are in terms of knee valgus doesn't cause injury. However, you need to understand the people who are not injured, what is happening in their tissue. Okay, I put a challenge out. I put a challenge out 5 years ago, and no one's done it. No one's done it still. I said, and I'll say it again, anyone who thinks knee valgus, doesn't matter who you are, is safe, go load up 85% of your 1 rep max, so that's your 5 rep max, all right, of a back squat, and do 10 sets of 5 reps with your knees touching. Coming, and then tell me how you feel. Tell me how you feel after that. If you think knee
Great,
valgus
wouldn't
is
they?
safe, tell me how you feel. And then like people send me videos of people standing with their feet like literally close together like this, and their knees are just caving in a little bit and then coming back out again. It's like, oh, this person's got knee valgus. This valgus movement is nothing compared to this,
Yeah.
right? So to to in summary, in order for the body to adapt efficiently, we need to train it in an optimal position. So when we are in a position where the body is in a suboptimal position, so for example, if we're lifting very, very, very big weight and technique breakdown is inevitable, we can then tolerate that weight in a bad position because the body has learnt how to tolerate higher loads in an optimal position. It's very hard for the body to adapt in a poor position because the risk of an injury is way too high. Right? This is why we say, for example, in the deadlift, I'm probably going to get some shit for this. This is why we say in the deadlift, we've got to keep a relatively neutral spine so we can apply the load correctly. So then when it comes a time where, we didn't lift this weight, we had a bit of technique breakdown in this lift. We had a bit of technique breakdown in this lift, but the person's not injured. Whereas if you were training in a poor position all the time and the person's load tolerance was insufficient, their risk of injury will significantly skyrocket. And let me tell you something, people who say, flexion under load is fine. Yeah, it's fine until you get a disc bulge and you got quarter equina syndrome and you need to go to the hospital.
Yeah.
Anyone listening to this podcast who don't know what quarter equina syndrome is, I recommend you Google it.
Yeah, 100%. That's why it's important to have the right technique, right?
Mm.
And we don't want injury and we don't want so many other things. But I'm so glad that you're talking about this topic to other osteopaths. It's going to be a lot of fun to do that,
Yeah,
sharing
yeah,
your knowledge.
yeah. I think look, again, I've been raving about this knee valgus thing for a very long time. Again, there's a lot of practitioners who disagree with me, they just disagree with me about a lot of things, to be honest with you. But this knee valgus thing, I just feel like it's, people make decisions a lot of the time on emotion, not on facts or not on data, and it's a bad way to be. You can't make decisions off emotion. I know we're all humans, we all have emotion, but we need to, as health practitioners and as professionals, we need to we need to make decisions off data to then help speed up the process of whether it's injury prevention or optimizing sport performance or reducing the risk of injury. That, if we understand data, all that stuff speeds up. All right. If we're dealing with emotion, I don't believe that study. That's all rubbish. I want this person to lift like this. All of a sudden, my back hurts. What have I done? All of a sudden, that process that I just spoke about is not accelerated. It's decelerated, which means they're going to be injured for quite a while. Their sport performance is going to reduce. Their optimization within their training program is going to reduce. Everything's going to decrease. So, again, these health practitioners, especially, need to understand that we do not conclude or make statements of feelings. It should be of data. I've heard that saying before, facts over feelings.
Yeah.
That's what it is, facts over feelings. And then people try to tell me, knee valgus is safe. Clearly not. Well, clearly you haven't read my paper. So you're telling me knee valgus is safe and you haven't read my research. So I don't know what you're talking about, man. But it's really not the most optimal way to perform lower body movements. Let me tell you that. And even
Yeah.
subjectively, Mihaela, you go to the gym and you do some lower body movements and you force your knees in and tell me how you feel. Tell me how
No,
you
it
feel.
doesn't feel good. 100%.
No.
It doesn't feel good. It doesn't feel good. Before we let you go, because I know we've got some time, I do want you to talk a little bit about the elite athletes that you've been working with and
Hmm?
how you've allowed them or assisted them to reach their goals. And then we'll wrap it up. How does that sound?
Yeah, sounds good. So most recently, one of the most most recently, one of the most advanced guys or advanced athletes that I've worked with. Last year, he ran 100 kilometers in the desert, which was phenomenal.
Wow.
Absolutely phenomenal. Like it takes a lot of guts and grit to do that. And literally, most recently, the same guy, he just ran from Adelaide to Victoria
Wow.
in a space of a week. I think it was something like that. So it was virtually 80 k's like every day.
And that's
Crazy.
running. Wow.
Running,
Non-stop.
running.
Crazy.
So the way we especially in strength and conditioning, like some of the best strength and conditioning coaches in the world, the way that they get athletes ready for competition is via periodization. So, just in a nutshell, what periodization is understanding which training factors to put where to optimize performance. All right. So, for example, if I know this person is going to be competing in 6 months, I'm going to work backwards. Okay, so this is the day of the competition. What training factors am I going to implement to get this person ready for that event? And that means throughout the process, I need to make sure that the adaptation process is efficient. I need to make sure that the nutritional intake is adequate. I need to make sure that the training factors that I'm implementing is complementing their goal and their sporting outcome. For example, with this guy who was a runner, I'm not going to make him do a bunch of gym work, 2 or 3 weeks out of the event. So generally, what would happen is we would get strong first. So early in the program, we would get strong. Um, and then as we get closer to the event, if it's running, as we get closer to the event, then we would switch or we will slowly transition the strength for more conditioning. So for more like running based training protocols, whether it's like long intervals or whether it's running for time or whether it's more distance running stuff. So that's what I would do. That's what I would do based on all my studies and everything that I know. That's what I would do. So um, yeah, so strength
I was
first,
gonna say it's crazy
and
thinking about someone who's
yeah.
running that you're gonna get them to lift.
I can't explain to you the research that's coming
It's
out currently
crazy. I love
on
that.
how lower body strength significantly increases what we call running economy. So how well we run.
Yes. Yes,
So
yes,
I can't
yes.
explain it to you. And now, if you talk to this guy now, he word for word he said to me, "My marathon running guys can't believe that I can keep up with them, and I don't run as much as them." Because he's stronger and because of how I've taught him how to train, he now implements that in his own training and his running performance has significantly increased.
That's amazing.
Yeah.
That's
So
amazing. I
again,
love
so
that.
it's strength first, strength first. This is why we call it strength and conditioning. We don't call it conditioning and strength. All right, it's strength first. Right. So
Yes.
periodization is the key when it comes to these advanced athletes. Periodization is the key. All right. You need to figure out where their competition date is. You got to work backwards, and you got to figure out, okay, so what am I going to do first? You don't want, because if you have a plan, if you plan everything out, you periodize everything. This is so when we're getting closer to the event, you're not smashing the athlete with all this type of training that makes them so tired that they then can't perform. Or
Yes.
if they're already fatigued from all the training, the risk of injury is going to be a lot higher as well. This is why we've got to periodize everything and plan everything. So when we get closer to the event, they are um, their tissues are conditioned and they're getting ready for the event while reducing the levels of fatigue, if that makes sense.
Yes, yes. Absolutely love that. I love
Hmm.
that. On that note, are you training for the next Hyroxy?
Potentially,
Nice. I
maybe.
love it. I love it.
I'm still thinking about it, but we'll see how we go.
Did you enjoy the last one that you did?
Oh, I loved it. I loved it.
Yeah.
It was people who were there who I knew personally. They all came up to me and they said, "This is who you." They go, "This is who you are. Like this is what you do,"
Literally.
because
Yes.
it's everything in one, right? Um, but I've been the type of guy, Matt, that I've never liked competing in things. I mean, I've competed in Muay Thai several times
Yeah.
before. I've had several fights. Um, but I've never been a guy to compete. I just like to train, and in my
Yes.
head, I train to be the best that I can be. Or as David Goggins will say, I train just to be ready. And
Yes, I love that.
people ask him why you're ready. He
Yeah,
goes, I've got to be ready. And
literally. Same here.
they go ready for what? He's like anything.
Literally.
So
Literally.
I trained to be ready. But after doing the most recent High Rocks, I
Loved it.
absolutely loved it. It was the culture, the environment. It was just phenomenal. The atmosphere,
The
um,
athletes, the people doing it, the bodies,
athletes,
you love it.
incredibly fit and strong human beings. It was actually really good to be around a lot of fit and strong people.
Yes.
Um, but yeah, no, it's real eye opener. And I think this is going to be one of the most popular events in the world in the next 5 years. To be honest with you.
Yeah, amazing, amazing.
Yeah.
Well, Andrew, thank you so much for sharing all this amazing information about strength training with us. I know we could talk on for another hour or
Hmm.
two about things, but I think the information that you shared is so valuable, and I think individuals that listen are able to just be like, okay, cool. I'm going to try my best to increase my strength and reevaluate why I'm going to the gym, reevaluate why I'm training, what are my goals. So if individuals do want to work with you, how can they contact you? Can they work with you? Do you have any spots?
Currently, it's a little bit difficult. Currently, next year I'm going to be re-evaluating a lot of things.
Amazing.
However, if people have any questions, they can just hit me up on social media on Instagram. It's just very easy, and I'll try and respond as fast as I can. But in terms of working with people currently, it's very hard. Apart from because at the moment I do teaching, and I'm still in clinical practice currently. So if people want to come and see me in my clinic in Baldwin in Victoria, they can. However, in terms of working one on one currently, in terms of like S&C stuff, even online, I just haven't got time at the moment. But next year, I'm going to be really re-evaluating a lot of things. I'm going to hopefully
Amazing.
open up some more spots. But the key
Amazing.
for everyone to understand is quality over quantity. Quality over quantity. You'd rather train 3 to 4 days a week and have really good sessions than train 6 days a week and half of those are mediocre.
I love it. Thank
Hmm.
you. Thank you so much. I think we can end it on that note. With a
Done.
beautiful, amazing summary. Thank you so much, Andrew. Thank you for joining us on our podcast. And remember, you're pure love and capable of living life to its fullest expression.
Content and information provided here is the opinion of Mahela Ragus and is for information purposes only and does not constitute medical advice. It is not intended to provide medical advice or take the place of medical advice or any current treatment you're undertaking. Consult your own medical professionals for any medical issues that you may be having. This entire disclaimer also applies to any guests or contributors to the Natural Health Podcast. It is advised that you consult your doctor or healthcare professional in relation to any health concerns you may be having. Mahela Ragus does not take responsibility for any health consequences which occur from a person listening, viewing, or reading this content. Under no circumstances shall the Natural Health Podcast, Mahela Ragus, any guests or contributors to the Natural Health Podcast, or any employees, associates, or affiliates of Mahela Ragus be responsible for damages arising from the information provided on the Natural Health Podcast. By listening to this podcast, you agree not to use this podcast as medical advice to treat any medical conditions in either yourself or others. Please note, if you're taking prescription, do not stop your medication or start a new protocol, including but not limited to supplements, diet, lifestyle changes without consulting your doctor or healthcare professional. If you or any person has a medical concern, you should consult with your healthcare provider or seek other professional medical advice. Never disregard professional medical advice or delay in seeking it because of something that you have read or heard on the Natural Health Podcast or in any linked materials. If you think you may have a medical emergency, call your doctor or emergency services immediately. Neither Mahela Raguz nor the publisher of this content takes responsibility for the possible health consequences of any person or persons reading or listening or following the information in the educational content.